Hello, everyone. My name is Hugo. So I work at Heidi, obviously. I've had a few roles in the medical knowledge team and now the customer success team. And my role tonight is really, I guess, just to be a shadow and help you guys learn from three amazing people who we have up on the panel tonight. Really want tonight to be a casual conversation, and at the end, we'll get some audience interaction as well. So at Heidi, look, our goal is to deliver care that feels more human. We have a big goal, and that is to double the world's healthcare by 2040. It's a big goal, but it's an exciting goal, and one that we truly believe that we can help achieve. So before we start tonight and get in to hear from these amazing panelists, I'd love to firstly start off and see who here actually has used Heidi before. Okay, fair few many. This helps us set the scene. Now, look, tonight, before I introduce you to these guys, tonight's not about a pitch. We're not just trying to sell Heidi, not a product demo, but really what we want to do is we just want to have a chat, learn, be curious, and hear about this world of AI innovation and how we're all thinking about it and going about it to, at the end of the day, help clinicians' lives be better and help patients have a better experience. So tonight on our panel, we have firstly Michelle Blanchard, who's the Managing Director at Magentis. We have Catherine Skellen. Now, Catherine is a paediatrician at the Queensland Children's Hospital. And then we have Soa Basia, who is I needed to get your exact title right, so I had to write this one down, the Digital Health Lead and Transformation Specialist, and also a doctor by background. And as I've said tonight, we're just going to try and keep this an open conversation and try and learn as much as we can from you guys. So to start us off with, I think I want to go back to the start and hear from each of you guys and hear, Michelle, how did you go about discovering Heidi? And look, why did you choose Heidi, and do you use Heidi?
Thanks, Hugo. Yeah, all good. Thanks for the opportunity to talk to you tonight. I head up Magentis Practice Management or Oncology. Our main products are Genie and Gen 2. So about 70% of private specialists in Australia use those, and also Charm, which is a medication management system for oncology. So how we heard about Heidi is obviously we are in the digital innovation space and are constantly finding ways to develop, grow and evolve our practice management software products. And doctors were telling us about Heidi, but we certainly already had AI scribes on our radar and what we were going to do about that ourselves, natively or not. So we've pursued a marketplace path at the moment with Heidi, and we have, as of last week, finally got Heidi integrated into Gen 2. So that is live now, and we will have Heidi integrated into Genie, Genie in not too distant future. Yep.
Catherine, what about yourself? How did you come across Heidi or AI scribes?
So I was what you could probably describe as an early adopter of AI. So I was using AI as a scribe in the latter part of 2023. So in my private practice as a developmental paediatrician, it is a specialty that is suffers from a lot of documentation burden and the multitasking of interviewing neurodivergent kids and complex families and having to document those experiences and produce a range of documentation to meet their needs for classrooms, for NDIS, for referring doctors and other health professionals who are involved in their care. So I started using a scribe, which wasn't Heidi at that time, and found that it was fundamentally life-changing in terms of my workflow and how I actually felt about my job. And an opportunity arose in January of 2024 for our chief executive of the Queensland Children's Hospital, created what was called the Imagination Fund, and I put in a pitch for the scribe for us to have a project to have this scribe being implemented and evaluated within our hospital organisation, and we were successful in doing that. So we then embarked on a procurement and tender process, and it was through that I started using. We selected Heidi. We were only looking at sovereign models and vendors, it was a narrower market than the broad, the crowded market of AI scribes in general. And then we embarked on this partnership with Heidi to implement this AI scribe across medical, allied health, and nursing practitioners, and we developed quite a robust research framework around this, which we are now literally days or a week or two away from submitting for peer review regarding our results, the evaluation of this implementation. And we know that there's a lot of interest from, we get constant requests for our data and our experiences, because literally the predicament that Hugo touched on is that this is a tool that is increasingly being adopted in private practice. Public hospitals have lagged behind because of perhaps a different kind of culture, I guess. And yet you've got health executives, literally clinicians banging on the door saying, I want this because I'm using it in private. I want to use it in my hospital job as well. So quite rightly, executives are looking for evidence to inform their decisions about an investment in this new technology. So that's what we've done, and that's what we're looking to provide moving forward as a sort of contribution to the space.
Thank you. I had a very similar experience at the beginning with regards to me using a very different scribe to begin. So I was actually on a competitor scribe, and I was also part of a WhatsApp group of doctors. And I got a message one night that said, and I guess I'm just sort of known in my group as the digital guy. The message said, have you got a login for Heidi? I said, I haven't got a login for Heidi, but let me look into this. And about 2 weeks later, I was writing an options paper for the Mater, exploring all of the...
Just some... Wow. I was going to say some technical difficulties at a technical event.
Is that better? Can you hear me? Okay. Where was I? Got the login to Heidi. No, I did not give the login to Heidi to anyone. I would never do that. But I wrote an options paper for the Mater, and this is really, an opportunity for me to delve into the market and to look at all these competitors. And, at this point there was, probably 20 even here in Australia that were, all competing for, the AI scribe market. And, Heidi stood out to me initially, especially as it had good uptake in the community, but not really at that point demonstrated, any uptake at the hospital, in the hospital ecosystem. But I thought what I would want to focus on was, what particularly made it so popular in the community. And, we looked at user experience as being, very important to us. And being a clinician, and if any of you are clinicians, I think many of you are, we're often let down by the user experience with a lot of the software that we tend to use. And if you're spending 9 hours of your day working on that, then that's not a great thing. So fast forward to 6 months later, we decided to put Heidi up against another competitor in one of our emergency departments at the Mater. And, Heidi did fantastic. The other competitor did well as well. But I would say that what stood out, and I think this is probably a learning point for all of us, is beyond the actual product, it's the company behind it, the support that you get. And we were looking for someone that could support an enterprise that could support multiple facilities, be there when we need them, when some of our doctors are struggling with the particular, with the platform. So for us, it was a journey. Maybe we should shuffle down. All right, take 2, take 3. So it was a big journey. It was a big leap for a hospital to make, right? Hospitals aren't used to sort of taking these kind of risks, and especially when it's territory that we've never been down before. There was a lot of questions. There was a lot of clinicians who were worried about patient safety, about consent, about what happens to the information. Is the recording shared? Is it stored somewhere? And we had to be prepared to answer these questions. And so as much as it was a journey for the clinicians, it was a journey for me to figure out how to get a hospital to buy a product and what are the necessary guardrails and safety points you need to think about. So I had a blast doing it. And similar to Catherine, we're very close to a broader implementation in our outpatients at the Mater, where we're really excited that clinicians get to spend less time documenting and more time seeing patients. So it's been a really good ride.
Sorry about this. Perfect. No worries. Sorry, I feel like it is like we're in that clinician environment where you've got a plan. Like I know when I'd go to see a patient and I have this plan and then you get hit with this curveball. So that's what I'm just treating this sound as. So it's quite real life experience what we're going through here. So we've heard about your guys' story on how you discovered Heidi, seeing as you've had the mic, although not much luck with it at the moment. Safety is an incredibly important thing, and that's well before we talk about AI. As clinicians, and we're working in healthcare, we have such a privileged position to have so much access to such personal information. And now adding in AI into that does add another layer. So would love to hear from your perspective, an enterprise perspective, and then yourself from integrations perspective, how you've gone about assessing safety from your perspective.
Yeah, good question, Hugo. So I chose to involve all the right people really, really early. I'm no expert when it comes to cybersecurity. I'm no expert when it comes to privacy. I'm no expert when it comes to health informatics. I am a jack of all trades in many ways. And one thing that you learn, especially as a clinician, is how to ask for help early. So I used to tell my residents, my students, everything is, I will never get mad at you if you come and ask me for help early. And I still carry that on. So I tap my cybersecurity director. I tap my health informatics director. I tap my quality and safety team early, and I bring them on board for the journey with me. And that gives me at least that kind of robust governance and coverage to make sure that when we do officially decide on going ahead with a product, all of the right things have been thought about. And, that takes you from your privacy impact assessments, your clinical workflows and the impact on those clinical workflows, and how do you consent patients. It's not to say that I'm delegating these things to someone else, but more so that I'm assembling a team, and it's a decision we make together as an organization. So that was my approach, Hugo.
So at the Queensland Children's Hospital IDCO, that it was obviously highly relevant as a government organisation that we met the requirements to ensure that what we were going to deploy was going to be safe and compliant with legislation. So the relevant experts in digital health were the ones that developed, and I think they were the first to develop the Information Security Risk Assessment Plan, or ISRAP, and the Privacy Impact Assessment. So those were the two pieces of work that had not been done before, but needed to be done before we could actually deploy the tool within our environment. There was a discussion around how the architecture of this tool in the context of the existing hospital systems that had to be sorted out. What were the guardrails? And an important part of the equation when it came to the onboarding of clinicians within the project was educating them about maintaining the responsibility. The human in the loop is a really important recurrent theme that's being spoken of in this context of AI, and I think in some ways not having an integrated tool, having to cut and having to paste something creates an extra layer of ensuring that what is written is actually accurate and adequately reflects what has been discussed in a consultation. So that's been the process that we have used through the browser or the mobile app system to use what's generated within the scribe system to then be inserted into medical records, and then subsequently to then generate the relevant documentation for a patient's needs. So I think when I'm talking to people, it's actually I always consent every patient. Surprisingly, no patient has ever said no, but I think that reflects that I think it leverages trust, that patients and families have a lot of trust in clinicians, and so they consider that, I think, in the context of giving consent for something that is actually quite unfamiliar. Within the parameters of our project, we assessed patients' perspectives about the use of AI in healthcare, and that was actually that was very positive feedback that we got, that people did welcome and would welcome in the future AI being used in their healthcare because they benefited from it. They benefited from improved clinician focus and attention, and they really placed a significant value on that.
Would love to hear from an integrations perspective as well.
Yeah, so from an integrations perspective, we have a very strict protocol that we go through with all potential integration partners within our marketplace. So we don't just integrate AI scribes, we integrate lots of different types of solutions that can be provided for practices from in the clinical space as well as in the admin area of the practice. And obviously one of the key things is where is the data stored, but it's also about the stage of the business and the maturity of the business and the structure that they have around it to actually have a successful go-to-market approach to getting the product in the hands of practices and clinicians, and that there will be that support there. So we get startups knocking on our door every single day because it's a great potential path to market entry for them, because the product would get presented in the sidebar to thousands of specialists across the country, but that's not what that sidebar's for. It's not purely for marketing. It's for providing solutions to problems that our practices tell us they have, and we can solve. Rather than us natively building the solution, we find partners to partner with, and certainly Heidi fell into that category. So Heidi's not the only scribe, but we have a small number, and the why we don't just integrate with everyone, besides the meeting the requirements, but also we like to think of our marketplace as a curated marketplace, because our customers, our specialist practices, they trust us. Many of them have been with us for many years, and if we are integrated with something, there's an implied level of trust for that product, and that we've done a level of vetting of that as well. So that's Heidi certainly made it on the list pretty early on, and we're really pleased to be partnering with Heidi in the scribe technology.
Awesome. Thanks for that. Catherine, question for you. I know myself as a clinician, when I found Heidi, it was and I would only want to refer to it as Heidi, just let's say as a scribing tool. It was quite a bit of we talk about an aha moment in product, but it was quite incredible to see. But would love to hear from your experience, how you've, the difference that you've found something before a scribe and now after a scribe, and how it's maybe changed your work, and maybe your life outside of work.
Yeah, so I guess it goes back to that sort of experience of becoming incredibly busy and having a large caseload of children and families who are complex and, as I said, neurodivergent at times. So there's a communication barrier at times, and the requirement on me as a clinician to not only pay attention and to convey care and empathy for what they're telling me is going on in their lives, but also to document that within the medical record, required placed a huge cognitive load on me. And then the dictation of the letters afterwards and the process of finalising all of that, etc., inevitably has impacts on how I felt about my job and how long I was going to stick at this. I love doing this work that I do, but as I was going through all of this, I was reaching the end of, can I really keep up with this kind of caseload? And many consultants that I work with alongside literally are unable to kind of maintain that sort of flow of patient after patient. They need gaps in their calendar, and obviously that in a private business world, that doesn't add up to adequate remuneration if you compare what they're earning in the public system. So the ability to retain and recruit people to be able to do my job after, long after I leave, I was concerned about how can we get paediatricians to step into the space. It's great work, they're great kids, great families, and there's a really good job to do here, but the documentation burden was massive. So when I first saw the scribe, and it is literally like, oh my God, like how it works. And I demoed it to my friend, who later became part of the project team in the Queensland Children's Hospital, because she didn't work in private practice. She's allied health, and she just looked at me and she said, I want that. And she was the one that found the opportunity for the funding grant for us to then set up the implementation within the Queensland Children's Hospital. So it was just one of those things, but that came about. But what we called it the Heidi moment. So as we rolled out the implementation, we captured all of these little snippets of things that people were saying. And I can remember one of the teams, you might remember this, Hugo, they said, every morning our team gets together and we just all go, how great is Heidi? Which is pretty funny because our resident is also called Heidi. But yeah, so it's been lovely to capture, just the quality, just those experiences of people suddenly finding the solution and being able to return to the reason why they chose medicine in the first place, which was and for me, that's literally what it's done, is it's actually enabled. I used to dream about, wouldn't it be great just to kind of just talk to people and say, this is what needs to be done, next patient, just go through and, do what needs to be done without all of this paperwork. And it literally did that. It does that. It literally enables me just to talk to people and to care about how they're feeling and to make expert decisions. And to me, that's what being a clinician is all about. And all the paperwork just takes care of itself. And that's not to say I don't have oversight and finalisation. I take that very responsibly. But it enables me to do the very job that I thought it was in the first place, and to keep doing it for some time to come.
Nice. Thank you. So I'll ask you this next question. Catherine alluded to that patients haven't had too much objection to it. But would like to delve into your experience on if you've had any objections to it, but also how you go about consent. So asking patients if it's okay, again, not to use Heidi, but to use these new innovative tools. And what's the process that you think about, and maybe even just how do you go about asking for consent?
Yeah. You can hear him better? How's that? Wow.
I was taking the limelight.
Yeah, the consent thing was really interesting. The conversations we had around consent at the Mater were like, they got down to a real nitty gritty level. You know, the patient, I think we sometimes overestimate how averse to technology some patients are. And I think I think this comes up on a number of occasions when we talk about data privacy as well. When in reality, I think a lot of patients are keen to allow clinicians to use any number of technologies so long as it contributes to better and safer care. So that for me is like, big takeaway is if you can rationalize why you're using this technology and how it contributes directly to looking after patients, then you're in a good position to gain their consent, right? Now, with that said, when we ran our trial, there were a number of no-go situations where it doesn't make sense to use a scribe. So we did have 100% consent with our trial because we equipped our clinicians with a script and we gave them some go-no territories, which is, this is probably not appropriate when a Cat 1 comes in and their arm's chopped off to consent them to use Heidi. They've got bigger issues. So I think that was a big part of our process, was understanding, what does consent look like in this situation? Do we bake consent into a declaration form? Does it make sense to get people to sign a consent paper every time that we see them? And, we actually went with the process of equipping our clinicians with a really good script that says, we have a piece of technology today that uses AI technology, and it allows us to care and consider and listen to you rather than take our time and document it ourselves. It means that I can pay attention to you while this machine or this tool helps me create a note and a summary of our interaction. Would you be happy for me to use that? Do you want more information? We've got a printout that I can give you. And I think that was really powerful. That went a long way. And, not many people even asked for the printout. A lot of patients were just happy with that. And, some patients were quite aware of the technology as well. They said, oh, yeah, that's all right. I've heard about that. I'll use it. So the number of patients that opted out was 0 during our trial. When we went to outpatients, we had about 2 patients that requested the paper and then said, no, they didn't want to be a part of that. And that's fine. It's not going to be a blanket all, and we're not interested in converting every patient. But it's still, if you look at that process, it's human, right? It puts the patient at the center of everything. And then it's about informed consent. And that informed bit is probably the most critical piece of the equation, right? Is what are we telling them about the process and the technology that we're using? And so that was our approach.
I'll take that one. I think this one will be the better mic. It's a great mic. Now, Michelle, I want to piggyback off this idea where we've been talking about consent, and I know you've mentioned you have other scribes, but so many other different, being a large health technology company, you have a whole lot of other products, whether you embed into yours or you acquire. But staying on this, topic of the patient and the patient experience, how have you found, or what feedback have you got that AI and new tools, how are they, and are they enhancing the patient experience?
So we make, oh, this is loud, gosh. So we make choices about what we integrate or put into our marketplace based on customer demand. And as I said, solving a problem for our customer and our user, which are the doctors and the practice admin staff. But the reason that clinicians do the work that they do is to serve the patient. So it would be very unusual, I think, that there would even be a request that would come our way that was for something that wasn't in some way connected to better patient experience or better patient outcome. So in a way, to us, I guess it's just taken as a given that that's part of the equation, because we don't make a decision on who uses it. So it's still the clinician's choice on which of these additional products that they choose to use, because not all of them are suitable or required for different practices. You know, there's 40, 50 plus different specialties and subspecialties in this country these days, and they all have very different needs. But certainly the patient experience is important. We are doing some work with some specific patient experience related tools, so prems and proms tools, etc. So there is very high demand from specialists for tools that, yes, help from an administrative perspective, but also very much help for that patient experience. And that's what we hear from a scribe perspective. It's not just about the doctors saying, please help me make my work-life balance better. They're saying, I can actually look at the patient in the eye and actually have a better quality conversation with my patient when I'm not staring at my screen and my keyboard all the time. So that's quite a common theme that we're hearing from our scribe users.
Perfect. Thanks. And to continue on from that, we've talked about this patient experience, the clinician experience, but these large organisations that you guys are at, and I'll direct this to Catherine, and so I'll start with yourself, Catherine. Change management, it's a real thing, and yes, a lot of clinicians may want it, and some patients may want it to spend that more time being able to look at their clinician. But when we're dealing with 1,000 people, 1,500 people or more, some who have been practicing for many years, change can be difficult. And so would firstly love to hear, how did you think about change, and how do you think about change management, and have you found anything that maybe works with this new space?
So just in terms of the parameters of the digital AI scribe project at the hospital, that's something we really wanted to drill down on, and so through logistic regression, looking at what are some of the variables that influence the uptake and adoption of this new technology. And we looked at that in terms of different clinical streams and age and workload and so forth. And I think the bottom line is, I did think that age would have something to do with it. I thought that perhaps the younger people may be more willing to adapt but in fact, some of the highest users of this technology have been older clinicians. And I think it's worthy of drilling down in more detail to better understand, but it likely reflects the experiences of that documentation burden that older clinicians probably have, and their ability to see the opportunity to alleviate that and the benefit to their patients. So we have sought to evaluate that, and I think it is worthy of a lot more research so that we can better understand those sort of variables. We found that there is a consistent theme across published literature that says that the disciplines that are suffering the most from documentation burden have the highest uptake of AI scribes. So, and it also the disciplines that whereby the consultation is the task centers mostly on what's discussed in the room, because that means that the deployment of an AI scribe in its most naive form, so if you just give a SOAP note template, it will work because it's going to leverage the transcript that's generated. For the more complex specialties, you need to have more thought into the design of the templates to really optimize the performance, because the purpose of those consultations is not just what's just discussed in the room, it's the context and what's and being able to have that integrated into the information that the scribe has to be able to provide a meaningful note and subsequent documentation output requires more template design. And so that's an important aspect of it. So that's why these things have been readily adopted in general practice, because it can be used simply and quickly for simple purposes of consults, and the adoption in more complex specialties, as an example, have lagged behind.
Yeah. Okay. I'll just at the Mater, it was interesting. When you look at the change management acronym ADCAR, and I think the D stands for desire, right? You don't have to sell water to a thirsty person. So these clinicians were, already primed for this. That made it a lot easier for me. And so, often when you're stuck in this position of trying to get innovation projects off the ground, it's either the executive staff are telling you this is what we're implementing and you've got to convince the clinical staff that this is the right thing, or it's the clinical staff telling you we want this and you've got to convince the executive that it's the right thing that we need. And so you're kind of stuck in this weird zone. But luckily with Heidi, you don't need a crazy business case, because it's a very simple concept, right? Doctors can see more patients in outpatients. We can prove that. Doctors are happier. Patients are happier. They get more attention. Notes are cleaner. They're structured. They're coded. There's so many things you can point to say this is a no-brainer. So the awareness piece was another function. So that's the A in ADCAR, right? And that's the people texting me at 2 a.m. saying, hey, have you got a login for Heidi, which is fantastic. So doctors are aware, clinicians are aware, they're online, they're bombarded with TikToks and Instagrams and things that say, hey, are you tired of documenting and things like that, which is fantastic. So things are changing on a change management front. A little bit, though, I would allude to what Catherine was saying, is how do you make the adoption successful? And making it sticky is all about onboarding and training and at the elbow support and getting around your clinicians to make sure that, even if they are a bit out of touch from a digital literacy point of view, you get around them to make them feel comfortable and they get the most out of Heidi. So that takes a lot of work. But for a product like an AI scribe, we're actually in a unique position where there's a lot of desire for it. And I've always said it's a tool that's available. I don't want to force anyone to use it. But what I want to do is teach them what they've got, of what's available to them, and show them how it can change their work. And if they're keen to continue dictating the old school way and typing the old school way, then that should also be an option that's available to them, right? It's a numbers game. We're not trying to convert everyone. Yeah.
Thanks. Michelle, Sob mentioned something at the start about innovation, and you're implementing something, and then we got to start convincing other people in our team, whether it be execs or whoever else. I guess the one thing is, we know innovation, it's not a new thing. It's been around for a while. I mean, we saw how fast things can happen during COVID with the uptake of vaccines. And I guess one question that we like to ask is, and being at an organization that has, looks at so many different companies, do we overthink it when we're assessing new tools, or do you think we actually need to be doing more?
When there's patient safety involved, I don't think there's really such a thing as overthinking. You can get, I guess there is that analysis paralysis, and maybe those that are reluctant to change can use the excuse for a continued assessment as a delaying factor, because they don't necessarily want to make a decision or implement a change. So it is important to find that right balance. But in this, because it's a new technology, I think that particularly the public systems are doing the right thing, but they have huge cohort of huge stakeholder base that they need to engage and help feel confident that the decisions that are being made around technology that's being provided for clinician use is the right one. It's much simpler if you're a specialist in your practice and you own it, and your partner runs reception, and it's a much quicker decision making. And if you feel like you've made the wrong decision, in a week's time you can stop and change to something else. It's a lot more flexibility there. But when you're talking about an enterprise level, and particularly in public health, I think there does need to be that due diligence. And it sounds like you've implemented a sounds quite efficient to me from what I've heard of procurement processes that have been pursued in other areas of public health. So well done.
So perfect. Now, about 35 minutes in, and wary of everyone's time. So I guess the back end of this, I wanted to sort of start thinking beyond Describe, beyond just Heidi Scribe, any other tools. So I'd like to hear from just maybe a short snippet from you all about what excites you about what's next in the AI space, whether that's with Heidi or someone else. What excites you and what do you want next?
Yeah, I think agentics is like, the thing I think about. It's like my ancient Rome. I think about it quite a lot, and I wonder how agentics is going to change the way that not just clinicians but hospitals work. So agentics is a really great concept, right? It's where we have these workflows or these processes that happen repeatedly, and they take up time, but they follow a trend and they follow a predictable sort of flow. Why not delegate that to an AI agent? And in healthcare, whether you're working in a clinic, you're working in a hospital, you're working in theater, there's so many of these flows, right? And so agentics to me are big in it, and I think that's probably what excites me the most. I think the value add for AI in healthcare is always going to be in the administrative side. I think that's where I would like to see it always sort of, plying its trade, if you will. And similar to what Heidi does, if you could abstract yourself and zoom out from Heidi for a minute, what it does is it says, let me take care of this administrative stuff so you can do the things that you got into medicine or got into occupational therapy to do or physiotherapy to do. You want to see patients, you want to, diagnose and think critically. Let us take care of all the other stuff, the scheduling, the booking, the follow-up SMSs, the things like that. That's what excites me.
It's not something that I've turned my mind to a lot because I've been very focused on the scribe space, but my thoughts around anything that improves the safety and quality of what we do has got to be a good thing. I get reminded that there are industrial implications of AI taking over humans who otherwise perform administrative functions. But that in itself shouldn't be a barrier to us doing things that make the delivery of healthcare safer and better. And there is, it potentially creates an opportunity for existing workforce to do other things and for the health system to evolve. So that's as much as I can say about that.
I concur with the comment associated with the admin side of healthcare. Certainly in private practice, there's a lot of admin required. There are essentially, many of them are small businesses. So what we are looking at is there's lots of opportunity for, in the clinical space, workflow automation, there's a lot of data entry numerous times, ensuring that we can get the flow of information more efficient and reduce the data entry. But then from an admin perspective, there's a lot of opportunity. Billing is a huge one. Our billing system in Australia is very complex in private practice when you have a combination of private health insurance and Medicare. Medicare is very difficult to navigate. Medicare love to reject, and with not a lot of context around why those rejections, that just adds to admin burden and then cash flow drain for the practices. So we think that there's a lot that we can do in that billing automation space. So that's something that we're focusing on next.
Awesome. Thank you. All three of you, thank you so much for sharing your insights. Before I open it up for some questions, I guess I just wanted to touch on how powerful it is just to hear from other people and this learning about this AI space, and I guess drawing upon your wisdom. And it's just a beautiful thing hearing you guys be transparent and talking about the things that a lot of us are thinking about and might not want to say or don't know how to go about them. For example, there was 9 trains go past in this presentation, and I'll bring it to the forefront because it's a good thing to chat about. Now, I guess what I want to do now is open up for questions and see if anyone has any questions for the panelists tonight about anything in related to their experience, AI, Heidi, or anything on the way.
Hello, everybody. My question tonight is more for, we've heard some wonderful things about how Heidi is used in an outpatient setting, but I'm curious with any trials that have happened in an inpatient setting, particularly for inpatient nursing or inpatient medical officers, what was found when there's such high pace of moving through patients, how the application was used then.
Yeah. I might let, Catherine, do you want to touch on that? Maybe
Yeah,
is this...
so I'll use that one. Yeah. So within the scope of our project at the Queensland Children's Hospital, we did have clinicians use it in inpatient settings. So that has been included, particularly paediatric intensive care as an example. But our data at the moment suggests the ease of adoption and the ongoing usage of it seems to correlate more strongly with the outpatient clinic setting. And I think it goes back to the comment I made before that so much of the consult is based on what's being discussed, whereas in an inpatient setting, there's a lot more context and information that needs to be drawn into what's actually being discussed with the patient. So I think it's utility and benefits require that it has been it's emerging, but I think we've got a lot more work to do in that space.
Perfect, thank you. Were there any other questions?
How did you find you went about different clinicians implementing different templates? Was there specific training on how to do that? Because I'd imagine across the different fields, people need specific templates, or was that relatively intuitive for each of the clinicians?
Do you want to go on or maybe?
So I'll start with my experience in private practice, as I was highly motivated to develop great templates. So I watched the training video and I learned how to do it. I'm not a tech person, I'm very technophobic, but I learned the method and I developed the templates for the work that I do, and it worked well. For the hospital project, we had a specific training video designed that for all of the new users when they received their log-on access. And then they were given vendor support through Heidi. So people like Hugo and others came to our hospital. They first of all studied what the workflows were and tried to understand what the nature of the work. They called them discovery sessions. And then they set out with this Herculean task to design the right templates to fit the clinician's needs. We didn't set any limitations so in contrast to some international studies where the implementation and rollout of scribes have given a very basic SOAP note to clinicians, we didn't set those constraints. We encouraged the clinicians to actually purposefully develop templates to suit their clinical environment. So that was something that I think is actually really essential. And I think moving forward, if someone was asking me what do you need to really optimize the benefits of this technology within an organization, I think having support, whether it's remote, having training and education information, not only emphasizes the responsibility of using healthcare, but of using AI in healthcare, but also how to optimize the utility of it by teaching clinicians how to write those templates. And it becomes, even in the period of time that this tool has been used, it is a dynamic tool that continues to improve and improve in its functionality, and the intuitive use of it is such that it's a different tool to when we started using it. Even when we started using it last year, it's different now. The large language model's different, it writes better. The way in which you can now have templates made for you is so much more simpler. So it's not a barrier, but I do think it's a really important part of the equation that really influences whether this scribe will work for you in your clinical context. I also think that privately, clinicians are highly motivated to do this, to get this right, to really, I would go home after a really busy day and I'd look at the outputs and go, what didn't I like? And I'd tweak it, I'd regenerate, and I go, perfect. I don't have to do that same edit. I'd go back to work the next day and it just works like a dream. And I didn't find that in some of the public sort of streams, that people were that motivated to kind of work on it. They're just like, I'm too busy, I'm doing this, that, and the other, and they didn't necessarily have that investment in optimizing their workflow.
Thank you. Probably have time for one more if anyone has it. No worries, I'll come down.
Hi there. So I come from about 2 generations behind you guys, because we're still handwritten notes and where I work in the hospital. What would be your advice to pitch an idea for a private hospital that's resistant to change, or a culture of people that are still in handwritten notes? They haven't even wanted to digitize their notes, but to move to the next step and think about, implementing AI and something like Heidi into the hospital. Yeah.
So I might pass this one on to you. Hear your thoughts?
So at the Mater, we don't have an EMR. We don't have an EMR. We're still on paper in the inpatient areas. So my advice to you, Caleb, is get creative, and remember that procuring an EMR is a massive process. And so going to your executive and saying, guys, I got a great idea. We just get an EMR and then we can get Heidi. It'll be great. It's not going to work. But I've seen Heidi used in some places where they print it out and they put it in the chart. That's one workaround. So you've got to get a bit creative about how you can make this stick in that area. But I think that what you're expressing is a frustration where there's a disconnect between the people that are on the call front and doing the work. And certainly it's frustrating when you don't have the foundational things you need to deliver innovative care, right? Or deliver that kind of quality of care that you need to do. So I share your frustration, and we're going through it. I think the Royal Brisbane's going through it as well. But we're finding ways around it. And, the outpatients is another really easy place to start. Clinics, and ultimately, Heidi is a tool. It's a tool that helps you generate notes. Okay. And so your ability to convey that message to whoever needs to hear that is about teaching them the benefit that will come with it. So the benefits that anyone will listen to in the executive space are obviously clinician experience, patient experience, cost savings, revenue, quality, safety. Those are the big ticket items, right? Some, and not in any particular order, but some of them they really care about. Wink, wink. Some of them they don't care as much about. Okay, and I'm confident in that. So come chat to me after this, and we'll make a plan.
I think it's useful to really help unpack what risks are attached to the business as usual model. And I think often these things get unsaid. But in our organisation, we had clinicians who never send letters to referring doctors. They're seeing so many patients in a short time period. And I think at one point the executive said, you need to be writing letters back to GPs. And they said, well, do you want me to see patients or do you want me to do letters? Because I can't do both. So there are existing risks. And I think any organisation should apply a lens of identifying opportunity to innovate and to identify those opportunities that can improve the efficiencies, and when it comes to healthcare, the delivery of healthcare, and to think of it from all of the necessary angles. So not just about the clinician well-being, perhaps that's the bit that I've identified because that's my lived experience, but the patient experience and the cost savings that we have been able to demonstrate through our research evaluation will soon hopefully be in peer-reviewed literature. And I think that's what health executives will be looking to have some evidence to support their decision, which they may think is maybe a little bit risky because they're not necessarily doing something. But this is the time. This is the emergence of the AI frontier. And it is really helpful, I think, to recognise that recruitment and retention of clinicians, having long, sustaining worthwhile careers in the jobs that we do requires substantial change to that business as usual.
Awesome. Thanks for that. I think we might finish it up there. But before we do, Michelle, Catherine, Soab, thank you very much for your time tonight. It's been a privilege chatting to you guys and hearing from you. I'm sure, not to speak for you, but be open if people wanted to come up and ask you questions tonight. And that same goes to the Heidi team as well. On that note, hope everyone has a lovely evening. Please stick around, chat to us, ask questions. And we hope you've enjoyed your evening. Thank you.